Welcome to Voices in Health. I'm Dr. Barbara Kostick. Today we have a special show on the relationship and generosity of two friends. Carla Wright and Christine Renner have been close friends all of their adult lives, ever since 1975 when they met as freshmen at Kostick College in Nevada, Missouri. Neither of them knew that they'd be sharing lunches, birthdays, and laughs for over 35 years. Their relationship grew as they shared thoughts and experiences. A phone call about a new job, a letter with photos of a new baby, spur-of-the-moment email invites to dinner. Carla Wright is now an attorney in Sacramento, and Chris Renner is a Washington hospital occupational therapist. Keeping in contact and sharing important moments of their lives and families over the years have made them very special friends. Then, in 1990, Carla was diagnosed with glomerulosclerosis, a genetic, slow-growing kidney disease. Last year, Carla was told she would need a kidney transplant. Naturally, she shared the doctor's advice with her best friend. And that is when Chris Renner made a big decision. She had herself tested. It turned out that the two women shared the same blood type. A month later, Chris called Carla with the news that they had a tissue match as well. Then it became clear that the two lifelong friends would be sharing the greatest gift of all. Chris would be Carla's organ donor.
Well, that's fantastic.
We welcome Christine and Carla to Voices in Health. Chris, tell me what attracted you to Carla.
Well, I always found Carla to be very hardworking. She still enjoyed having a lot of fun. We were in college together, but she just was an achiever, and she also had to work during the time we were in college, and I just really admired her fortitude. And then in later years, knowing what she did to get to college, it made me admire her even more.
Carla, how do you think your friendship has lasted all these years?
Oh, I think it's lasted because Chris really knows how to be a good friend. She's very reliable, very responsible, but she's a very good listener. And I just really couldn't imagine my life without her in it.
Tell me about your kidney disease.
Back in 1990, when I was pregnant with my first child, they discovered that I had protein in my urine. And so I got assigned to a nephrologist, and they started following me from that point on.
And this kidney disease has affected your life in a lot of ways, hasn't it?
Well, it's not as dramatically as one might think. Right now I'm fatigued more. I take this shot every other week called Procrit, which is supposed to help me with my anemia. And I have some really bad episodes of gout on occasion, which is related to that. And my nephrologist thinks that the kidney transplant will resolve that. But by and large, that's about it.
Chris, why did you decide to become a kidney donor?
In terms of my relationship to Carla, when she first talked about it, I felt like she's such a hard worker. She has a really strong work ethic. She overcomes things even with a lot of adversity. She's very quiet and doesn't complain. And I just felt like if I could do something to help her, that I should do it. And when I got the opportunity, and she really put it to me, do you want to follow through with this? I thought, well, might as well continue along that path. And I looked into it, and fortunately it's worked out. Because at this point, I'm the only one that came forward in that period of time. Then we have the same blood type, and we were a tissue match.
Well, what are the requirements for a kidney donor?
The requirements initially are to do a tissue match. Very often, you don't have to be a blood match, but being a tissue match is integral to the whole process. And then I had to go through a series of battery tests in order to be accepted. But back in December, I found out I actually was a tissue match, and at that time, I was able to call Carla and tell her. And then it was just before Christmas scheduling. I had to have a treadmill, angiogram, some of the other diagnostic testing I've had because they was age related, so I didn't have to go through some of that again. But generally, it was because fell on just getting those other tests done and my blood pressure.
Yeah, and aren't there some restrictions too of donors? If someone wants to be a donor, don't they have certain restrictions, Carla?
Well, they have, yes, they have to have a BMI of a certain level. They can't exceed that or they won't be accepted into
So you
the
can't be
program.
too fat?
Yes.
Okay.
At bottom, that's
Well,
the
I
main
mean,
issue.
that's good to know if you want
It
to be a
is.
possible donor.
That's right.
Any other restrictions on that?
Well, I presume you have to be healthy and young. I don't think you can be over a certain age. I don't know what the cutoff is, but I would think that would also be a restriction.
How do you think this whole process is going to change your friendship?
Well, at this point, we're really joking a lot about it. And, you know, pretty much, I don't think it'll change anything. If anything, make us stronger. And the way I look at it is that the kidney is a gift that I'm able to give Carla. And I know she'll take good care of it because she's taken good care of the ailing ones for this long. And, you know, it's just been it's something that it's kind of amazing that you can have two of something in your body and you can give one to somebody you care about and that it doesn't change your life. It's not going to make any difference to my life. I don't have to make any kind of, I have to maintain a healthy weight and continue to exercise. But as I get older, that's something that's more important anyway, because you want other body systems to continue to function normally. So.
Well, you are having surgery soon. Are you worried about the surgery at all?
Oh, I'm a little nervous.
Are you?
Yes, a little nervous about the surgery itself, but I'm far more nervous about the autoimmune drugs that I have to take after the fact, because you just don't know until you start taking them what the side effects will be, and you don't know what dosage you'll have to take. So there's a pretty dramatic time frame in which they regulate you. So you have to go in twice a week for blood draws. You go in once a week to clinic. I spoke with a woman in Vermont who just had this done, and she said there was a 2-week period for her where she was in the clinic every day, sometimes twice a day, because it's just so important to get the drug mixture correct so that you don't reject that kidney.
So you've already moved on from the surgery to post-surgery. Have you been doing that too, Chris?
I think I have, and part of it is because I'm an occupational therapist, and I've really had to think ahead on how I'm going to be able to function in my own home. I do have a sister that will be helping me, but she has 2 children, and so I recognize that I need to be as independent and functional at home as I can be. And I think my training has really helped me to make that a priority.
Now, I hear in the hospital that you two will be in separate rooms, but you might get to be bedmates again in recovery when you get out?
Yes, I'll be staying with Carla and her husband at their home in Sacramento for about a total of 7 or 8 days after the surgery. And Brian's going to be taking care, her husband's name is Brian, he's going to be taking care of us. So I'm hoping to share maybe at least a couple of sessions watching a movie, hanging out with Carla, and kicking Brian out of the bedroom so we can just hang out and watch TV.
Yeah,
and
be fun.
And he's, I know he's going to take excellent care of us because he's been planning what he's going to cook and how he's going to be able to deal with both of us at the same time.
Well, you two met in a dorm that wasn't co-ed, but sounds like you're moving into a co-ed dorm.
Yeah, seriously.
You think this is going to bring up memories of college at all with you?
Oh, I think we'll have a few nights like that.
Yeah,
we'll probably have
so.
popcorn and a movie.
Oh, yeah.
We're looking forward to that part a lot. The recuperating together is going to be a lot of fun.
When you're in the hospital, what happens?
Oh, separate rooms. We wanted to be in the same room, but they wouldn't let us. They said that being in the same room impeded your recovery because you're so worried about your friend that you don't focus on your own health.
It made sense.
Isn't that interesting?
It made sense.
That is
I
interesting.
was surprised by that.
But I think a big part of this is knowing that Carla's going to be down the hall recovering, and then I'll see her. You know, being in it together with somebody.
Yeah, that was a big thing for us.
And also knowing that Carla, you know, she's got challenges. I just have to get my abdominal muscles back again, but she's got to do a lot more than that.
That's very good.
So.
Well, Carla and Christine, thank you for sharing your story with us about giving the gift of love, and good luck.
Thank you.
This is my linear accelerator.
This is my cardiologist.
This is my CT scanner.
This is my surgical tray.
This is our registered nurse.
This is my digital mammography center.
Washington Hospital is not owned by a corporation.
It is owned by and open to everyone in our community, including you.
This is my hospital.
This is my hospital.
This is my hospital.
You were not created in 2 dimensions. You are a complex construction of muscle and bone, blood vessels and synapses. Seeing your inner workings takes some equally sophisticated technology. That's why at Washington Hospital Outpatient Imaging Center, we've invested in the most advanced digital imaging equipment so we can diagnose you quickly and accurately. We see the whole you to treat the whole you. Go to WHHS.com to learn more.
You know what? Sounds like you got some kind of acid refluctuations going on. Probably have an over-exaggerated intestine. I'm telling you, a couple of snips, that thing's out of there. Takes the pressure off so you can air out the internals. I'm no doctor, but trust me.
Presenting the InHealth channel, a much better source of information on issues affecting your health and safety. Brought to you by Washington Hospital.
You just gotta eat standing up.
Transplant Donor Network. This is Joan. May I help you?
The California Transplant Donor Network is a link between organ and tissue donors and individuals awaiting transplantation. Organ and tissue transplants offer a patient a chance for a healthy and more productive life. The life-saving transplant surgery is becoming more and more successful, but the number of donors is not increasing at a rate to meet this need. To help inform us of this process, we welcome to Voices in Health, June R. Wallace, the Community Development Coordinator of the California Transplant Donor Network. Welcome, Joan.
Thank you, Barbara.
What's the first step you do to become a living kidney donor?
The first step is you need to be examined by your physician so that he may determine or she may determine if you're eligible to become a kidney donor.
So how could I add my name to the donor registry?
How you can add your name to the California registry, there's a few ways that you can do it. You can apply at the DMV when you're renewing your driver's license or your California ID, or you can go online to www.donatelifecalifornia.org.
I'm a little concerned that I would be treated differently if I were an organ donor.
Barbara, you would not be treated differently. That is a myth. Because in our medical field, the doctor's main concern is to give you the best possible care that they can possibly give you as a patient.
And then how would my organs be dispersed?
Your organs are allocated by DNA, matching size, and blood type.
So how does the donation process work?
So the donation process works, you're in a hospital setting. Mm-hmm. We're called in because every intimate death has to be reported. We're called in and we begin to work with the team in the ICU setting. And then we're called in and our job is to match the recipient to the donor. And how we do that is our team, which is our placement department, they're working with UNOS, which is United Organ Sharing, and they run the list. And when the list is ran, it's not ran by anyone's name. It's ran by type and match and size.
How long do you have to wait for a kidney?
Barbara, a kidney, unfortunately, 7 to 8 years.
Oh my goodness, that's a long time on dialysis.
That is quite a long time.
And what about the families? Should you tell your family if you're an organ donor?
I'm glad that you brought that up. That is the most important thing we ask. Please have this conversation with your family. It makes them much easier for them when a crisis arises.
I think there are a few other myths with being an organ donor. Something about, can you still have a good burial service? And
people ask all the time, am I able to have an open coffin? Yes, you may. People ask, does religion play a role? Most major religions support organ donation. Then they ask, well, is the body mutilated? The body is taken care of in the greatest possible way.
Anything else you want to tell us about it?
I've been working for the Transplant Network for 10 years. And when I see people that are on the waiting list or waiting to receive an organ, it just gives me the drive to even work harder to educate the communities about this precious gift and how so many families can live on through you. Each year, around the month of April, is what we call National Donate Life Month. And in November is National Donor Sabbath. And that's when we educate the community across the nation about the importance of sharing the gift of life. You cannot give a greater gift when you give the gift of life to have a person to continue their life.
June, how did you become involved with the Transplant Center?
Oh, Barbara, I worked for UCSF and I worked in Neural ICU. And I was a clerk and a cardiac monitor tech. And so I was the person that would call to the California Transplant Donor Network and say, we have a potential donor. And then one day, an African-American nurse and a Caucasian nurse walked up to me and says, we've watched you work with the families and we think you would be the perfect fit as a community outreach coordinator to educate the African-American community on organs donation. I said, me? Of course not. I'm African-American, and when I die, honey, it all goes with me. But then I began to think, and I started looking at some of the books that we had on organ donation, and I went upstairs to the 9th floor, and when I went into the dialysis center, I just grabbed my heart, and I says, why are all these people in here? Why do they all look like me? And the nurse began to explain to me about kidney failure and dialysis. So it changed my mind. I said, maybe I can make a difference. Maybe I can make a difference by educating the community, especially the communities of color, that organ donation is not a bad thing. It's not in anyone's culture. It has to be taught. And I've been on this journey for 10 years, and I've loved every moment of it, and I would not take anything back. And what I have learned to educate my own personal family, the communities, about the gift of life. And it is a gift, a great gift. And I'm glad that I've been a steward to be able to help with this gift.
Well, you know, we do worry, being a donor, that our gift is given to someone who needs it and not just a rich or famous person or someone who can buy their way to the top of the list. Can you talk about that a little bit too?
The list is not controlled by rich and famous. The list is controlled by weight and time. So someone is taking dialysis, maybe right now dialysis is helping them, but someone else dialysis is not. And then your name just begins to go to the top of the list. And sometime when you're at the top of the list, you're going to get an organ quicker than myself if I'm midway, but I'm doing okay. Rich and famous has nothing to do with it.
So do you have any last words or advice on what you would give to someone who would like to donate?
The advice that I have, first, talk to your family. Talk to your family and make a decision. Because if you make a decision, your decision that you make could save someone's life. And wouldn't it be a great thing that if I left my heart, my lungs, my kidneys, my eyes, my skin, my bone, and my tissue for someone else to live through me? That's what I leave them with today.
That's a wonderful sentiment. Thank you.
Mm-hmm.
Washington on Wheels brings health services to people in the community who otherwise wouldn't have access to quality health care. And take it from us, there's nothing more frustrating than being denied access. To find out when Washington on Wheels is pulling into your community, go to our website.
Every woman is unique. At the Washington Women's Center, we take a unique approach to your health. We offer a comfortable, supportive environment, state-of-the-art technology, health screenings and resources, and we're the first center in the Bay Area to be named a nationally accredited breast center. We're more than a health provider. We're your health partner. Call to schedule an appointment.
Flannel pajamas get rid of a cold 20% faster. You can clear up pink eye by watching black and white movies. I put garlic around the kids' necks. They stunk, but they were healthy. I raised 3 kids. I think I know a thing or two about doctoring.
Presenting the InHealth channel, a much better source of information on issues affecting your health and safety. Brought to you by Washington Hospital.
You're not even listening to me.
Carla Wright and Christine Renner have been close friends since 1975, when they met and shared a dorm as freshmen in college. When Carla needed a kidney transplant, it was Chris who volunteered to donate one of her own kidneys to her best friend. It's the day of transplant surgery at the University of California, Davis Medical Center in Sacramento. There will be 2 surgeries today, the extraction and the transplant. Chris will undergo the tougher of the surgeries, but she'll have an easier recovery than Carla. Carla's recovery will be potentially more difficult because of the anti-rejection measures that must be taken. Both surgeries were quite successful, and both women were up and walking the next day. Chris left the hospital after 48 hours. Carla was able to go home 2 days after that. So, Carla, now that almost 8 weeks after your transplant surgery, how are you feeling?
I'm feeling great. It's been a marvelous experience. Everyone at UC Davis was wonderful, and they did a lot of education. So I've been able to learn the medicine regimen very well, and I'm making the transition to monitoring my body most days by taking my blood pressure and weight and temperature and taking all my meds on time. So it's all good.
And Chris, you had the more difficult procedure. Did you have any more problems with that?
Well, I came to realize that a surgery of this kind was very stressful on your body. And I'd say probably for about 2.5 to 3 weeks, I felt a little off generally, but still kept up my activity level. Carla and I both went on a walk with my sister the day after she came home from surgery. We walked a good distance to the park near her home.
Wow, that's great.
Yeah, and we both had to kind of find out that we overdid it just a bit. But the first day I was home, I showered by myself. I was able to get in and out of bed by myself. The only thing I really needed assistance.
You're so much an occupational therapist. You had to tell me about your daily living requirements. That's good.
But I think it was just the initial process of getting to know your body again after having gone through the trauma of the surgery. And once that kind of played out, then everything kind of goes back to more of a normal pace than what you're used to.
Carly, did anything come out as you didn't expect?
Yes. Before the surgery, I was very afraid of the anti-rejection meds and what impact that would have on my life, because they tell you all the horrible side effects you might have, like a headache or nausea and vomiting, tremors. I mean, some really terrible things, but I didn't experience any of those. The only side effect that I've had so far is a little numbness in my toes, which is medicine related, and sometimes they try to adjust my meds to help that up a little bit. But other than that, I haven't had any problems, which is I'm very grateful for.
Yeah, you look wonderful.
Well, thank you.
You really do.
I feel well.
That's good. So what about you, Chris? How are you doing?
Well, I think in terms of the recovery, there were things that I anticipated that Carla would also experience. But considering where our incisions were, mine being in the abdominal area and hers on her side, there were things that she had a different adjustment to than I did. It was difficult for me to sleep other than sitting up for the first week, where Carla, because of where her incision was, she was able to sleep more comfortably. Of course, we both were up together the first night at 2 o'clock in the morning for 3 hours watching TV because we couldn't sleep. And but we shared a lot of the ups and downs with each other, and it made the recovery while I was in Sacramento, I think, much more. It went more easily, and also it motivated me to continue at my own level once I returned to my own home, and I was alone. So.
And has your relationship changed at all now after the surgery?
I think it has. In those first few weeks after surgery, we talked on the phone every day. We compared how we were feeling, our ups, our downs, our pains, our amount of medication we took, our activity. I was actually driving 2 weeks after surgery because I needed to go for a post-op. It wasn't ideal, but I was able to do it. And when I visited Carla again, 2 weeks later, I could see how much better she was feeling. And that was a nice boost for me.
Made you feel good too, didn't it? Yeah.
It did.
Yeah, you can see she's just glowing about this too.
I know, it's great.
So Carla, how is your life different now?
Well, my life is different because I have to be very connected to my body. I have to be very vigilant about anti-rejection, which at first was pretty daunting. I was feeling a little sorry for myself and thinking, what a horrible way to live your life. But it actually hasn't been that intrusive. You just get into this routine every morning. You take your temperature, you weigh yourself, you take your blood pressure, you write it in your book. You have this big transplant book where you write all of your meds and all of these details because you may eventually have to share that with your doctor to adjust your medications. So the biggest part for me has been adjusting to that sort of lifestyle. And it actually has not been that difficult. Other than that, I feel great, and I'm working on getting my stamina back, which I think is just a product of the surgery. So I should be able to go back to work in the near future.
You know, Chris, you're really a special person to do this. Do you give in other ways too?
Well, I think part of that is evident in my profession. I've been an occupational therapist for almost 28 years. And I also volunteer in animal rehab, which I enjoy quite a bit. And I do a lot of other just little things to help people. It really gives me a lot of joy to be able to help people. And you get so much back in kind that you don't even expect.
And you take good care of your pets too, right?
I do take good care of my pets, probably better than I take care of some people now. But no, I take really good care of them, and it's been nice to be home with them and be able to enjoy them while I've been off recovering.
Have you developed a different sense of your life since you've been able to give a kidney to someone else? I mean, have you changed your behaviors or thought about it differently at all?
Well, I know that they've educated me as well at UC Davis that I need to maintain my weight. And I have a lot of family history of cancer and high blood pressure and things like that. And I've really felt like I want to really stay on top of it so that I don't develop the types of problems that my ancestors have had. One thing that has been really great is they had warned me that my blood pressure might increase and I might be prehypertensive. And my blood pressure is exactly what it was before the surgery. So I really think it's more just a matter of, as I get older, to stay very vigilant about that. And I have a little bit of weight to lose, but I feel healthy, and I've been strong enough to be able to go back to doing aerobics, which is, I think, one of the reasons that I have recovered very well, because I've done aerobics for over 20 years. And it's really also given me a goal to continue my current lifestyle and be able to increase it, because obviously I can't do the aerobics quite the same as I did before, but I've been going to aerobics classes now. I've been back for 3 weeks already.
Good. So life is almost back to normal for you.
Yes.
And then Carla, what advice could you give to other possible recipients?
Well, stealing from Nike, I would like to say just do it, because I found through Chris that it's a very rewarding experience. Although you will go through a period of discomfort for a few weeks, it'll be a distant memory in no time, and you'll get so much more from it than you would ever have imagined. So I would encourage people to please donate if you can.
And tell me about Chris. Can you give me some adjectives to just how you think of Chris? I know she's going to get uncomfortable, but do it anyway.
Well, she's very giving. I mean, this is the gift of life. I'm very grateful. She's a very warm-hearted, good person. And not many people are as altruistic as she is. I think she stands out in that way. She's a good friend, and she's a good listener, and she's just a dear friend.
You have anything to add? You get your time.
Well, I think that, as I might have mentioned to you before, I really admire Carla a lot. And she's come through this, she's been such a trooper. And I could tell that sometimes I consider her to be kind of stoic. She doesn't complain. I can see it in her face when she's upset or stressed. And just the way she rides out the storm is really impressive. I've always felt like she is just a really strong person, and the fact that she took this risk, because it was a risk, to have this donation, that it really inspires me, and I want to tell everybody I can find how great she's doing, and I can tell you too, she's chomping at the bit as far as getting back to exercise and work, because she's also got a very strong work ethic, and I think it even plays out in how she's recovering, because she's being very strict with herself about everything that she does and following the guidelines that were given to her, and it's just more of the same. It's like it's Carla, but now now she's got a new kidney, and she's taking care of that as well as everything else.
So what advice would you give to a potential organ donor? I
would say to find out if you can be a match, because you don't necessarily have to be a match with that specific person. There's also an opportunity to I forget what the expression, the term is for it, but there's a way that you can donate to someone else, and then they can donate to that person who needs the kidney, who you know. And I was willing to do that as well. And I would just say, just don't hesitate. Just find out. There's nothing wrong with finding out if you're a match. They tell you all along the way that if at any point you have fear or your trepidation, you don't want to do the donation, they will happily find a way to make you, for you to bow out. And that they remind you that all along the way. And it really makes a difference, because you know you have an out if you need it. I never opted for that. I never thought about using that. And at one point when I thought there might be an issue with my blood pressure and they told me there's a potentially I might not be a donor, it actually made me angry, because I felt like I had come so far. And then to be told, for a good reason, that you might not be a good donor, then I was all for, let's just forge on with this as much as we can.
Chris and Carla, thank you for sharing your inspiring story. We wish you both a bright and healthy future. The number of organ donors is not increasing as rapidly as the need. Like Christine Renner, you too can become a donor. Taking a couple of minutes to register as an organ and tissue donor can mean a lifetime to someone else. To find out more about how you can give the greatest gift of all, and to add your name to the Donate Life California registry, sign up at donatelifecalifornia.org.